Good afternoon, everyone, and welcome to our webinar series, Expert Speak, in association with IABSC, the International Association for Business Analytics Certification. Today, we have with us founder of IABSC, Mr. Hans Wokus, joining us from the Netherlands, and he will be introducing our speaker for today, Dr. Bhagwati Prasad. Over to you, Mr. Hans. You can take this forward.
Okay, thank you. Hello, everyone. I am Hans Volkes, founding director of IBEC, and I have the honor of introducing to you today our keynote speaker. Dr. Bhagwati Prasad is currently serving as lab director at a multi-omics firm, Fishy Incorporated. He has more than 23 years of experience in the healthcare industry, biotechnology, and is involved in many digital health initiatives. He has worked with organizations like TransAsia Biomedicals, Randox Laboratories, Span Diagnostics, WeSchool, and IIT Bombay. He also has a PhD in biomedical engineering and his master's degrees in biomedical engineering and physics. He's a real healthcare authority in builder theory as well as in practical experience. Please give a warm welcome to our keynote speaker of today, Mr. Bhagwati Prasad. The floor is yours.
Thank you very much, Hans, for the generous introduction. Thank you, IABSC, for the opportunity. And I'll start sharing my slides. I'll switch off my video so that we can save the bandwidth. Okay, but I'm here.
Okay.
Meanwhile, while we are starting our presentation, I would request all the participants to please post your questions in the chat, and we will be presenting it to our speaker at the end of the presentation. Dr. Prasad, you could continue.
Yeah, thank you. So the topic of today's talk or webinar is transforming healthcare with AI, and specifically talking about a little bit about how AI can be useful for improving equity and access. My name is Bhagwati Prasad. Let's begin this session. And also, good morning, good afternoon, good evening, depending on where you are. I know that we have really international audience today here. I want to start by a couple of disclaimers. First of all, I did not use any AI for this particular presentation. All the views that I express today are my personal views, and they do not necessarily represent my employer or organization's views. And third, I have also included several links, sometimes product names, website names, or company names. And these are only included just to deliver a specific message to the audience. And I have no commercial or other interest in any of these companies or products. So I thought it is important to point that out too. As far as my talk is concerned, I have kept my talk very, very simple. It is actually at very, very introductory level. This is the brief that was given to me by IABSC that the audience may not have background in AI as well as healthcare. So I've kept it at undergrad 100 level course. It is an introductory level webinar, and there is not going to be any technical information. I have divided my talk in three sections. The first section, I'll talk about the healthcare sector and challenges. And because I'm based in Mumbai, India, I have actually taken some of the examples of what are the challenges in India specifically. Second section, I'll talk about AI a little bit. And the third section is the main topic of today's webinar. I will cover here some of the applications of AI in healthcare, specifically concerning how AI can be useful for improving equity and access. I'll take about 30 to 35 minutes in my entire presentation. Each section has about 8 to 9 slides. All right, so let's go to the first section, which is about healthcare sector and the challenges. So if we talk about the healthcare sector, many people who are not from healthcare, they tend to think that the healthcare is primarily or only about hospitals. So this slide is just to give you a quick introduction to healthcare sector and at least to list that there are 6 main segments within healthcare sector. Hospitals, of course, the main segment, but there are at least 5 other segments within the healthcare sector. So I've listed those segments here, and on this right-hand side, I will also give some examples, especially in India and some MNC companies. So hospitals, I think most of us are familiar, and I've taken examples of government hospitals and private hospitals in India. Some of the examples in India for government hospitals are now in the box, and the private hospitals are also listed there. Second segment within healthcare is pharmaceutical companies. These are the companies which are making or manufacturing chemical compounds or medicines for use for humans or animals. Once again, some of the examples of Indian companies as well as MNCs are listed now in this box. These are the examples of pharmaceutical companies. Third segment within healthcare is the diagnostic companies. These are the companies which typically take body fluids and then they'll do some analysis and provide diagnostic services. Again, I've taken only Indian diagnostic company examples here, but these company names are listed there. The fourth segment in healthcare is that of medical equipment manufacturers. These are the companies which are making some consumables. Sometimes these could be implants, and these could be high-end equipment also. These are the medical devices, medical equipment. And again, some examples of domestic companies in India and MNCs are now listed next to this pointer. Fifth segment in healthcare is that of medical insurance companies. These are the companies which are sort of covering the risk of hospitalization or medical treatment in case of sickness or hospitalization. Again, some examples of medical insurance companies in India are now listed in the box there. And the last example that I've taken, sixth segment, is that of telemedicine. These are the companies which are providing, remote access, or in rural areas or areas which are difficult to access, telemedicine or that type of services. I have also included some examples of healthcare IT, which is because it's not listed in these segments. Healthcare, some examples of healthcare IT companies are in the last row: Cerner, CTS Tech, Epic, and McKesson. So, as I said, the purpose of this first slide was to quickly tell you that healthcare sector is not just about hospitals, but there are at least 5 other segments within healthcare sector. Again, this slide is specifically for India. So, healthcare is among the largest employers in India. Actually, it is the 4th largest recruiter. Many people, even within India, do not know about it. It's the 4th largest recruiter in India, followed the other 3 are agriculture, retail, and real estate. And at this point in time, approximately 7.5 million people are working in the healthcare sector in India. And with the emerging technologies, telemedicine, data analytics, virtual assistants, AI, etc., it is expected that in the next decade, another 3 million jobs will be added to healthcare sector. Once again, this slide is about India. So in India, the healthcare market is growing very, very rapidly. The CAGR, that is a compound annual growth rate of healthcare sector in India, is 22%. In India, the GDP itself is growing at a rate of over 7%. So imagine that the GDP for the country is growing at a rate of 7%, whereas the healthcare sector is growing at a rate of 22%. So healthcare sector is growing at a rate 3 times faster than the GDP. So the key takeaway from this slide is the healthcare is one of the fastest growing sectors in India. And in this slide, I've compared BRICS countries, that is Brazil, Russia, India, China, and South Africa, and how government expenditure and total expenditure on healthcare compares in India compared to other countries within what is known as BRICS, right? Brazil, Russia. So this particular bar chart is a bit old, but these numbers have improved a bit. So in India currently, I think government spends approximately 2.1% of its budget on healthcare, and if you include the public expenditure, that is out-of-pocket expenditure, also that expenditure, total expenditure out of GDP in India will be about 5.1% or so currently. Again, even after these updates, if you see compared to other countries in BRICS, India healthcare expenditure is lowest among the other counterparts. Again, the key takeaway from this message is in India, there is a huge scope for growth, and that's probably one reason why healthcare market is growing at a CAGR of 22%, because there is a huge potential for huge gaps are there. In a way, there is a huge potential for growth here. Now, this is where, in a way, the main topic about inequity, etc., is starting here. So this particular column chart shows personnel and infrastructure. What is the status. Again, this chart is a bit old, but the numbers more or less hold even today. So WHO, which is World Health Organization, that gives some recommendations for healthcare infrastructure. So, for example, for number of doctors per 1,000, WHO recommendation is that there should be one doctor per 1,000. But in India, there is about 0.65. There is a gap of about 35% there. If you look at the number of nurses, WHO recommends about 2.5 nurses per 1,000. Again, there is a gap of nearly 45-50% there. And if you look at the number of hospital beds, WHO recommends 3.5 beds per 1,000. Again, there's a gap of 60-65%. So this is where, as I said, the topic of my presentation starts. This is where you start seeing that there are some recommendations given by WHO, but there is a huge gap in terms of manpower, as well as, I can say, woman power personnel, as well as healthcare infrastructure in healthcare. And whatever infrastructure is there in India, further, if you see the rural-urban split of population versus medical infrastructure in this particular chart, I've compared availability of doctors. So in India, 2/3 of the population stays in rural areas and 1/3 in urban areas currently. Whereas if you see the percentage of doctors, it is completely opposite. Approximately 2/3 of the doctors are practicing in urban areas, and rural areas, though they have 2/3 of the population, there are only 1/3 of the doctors. And this particular chart, though, covers percentage of doctors. If I extended the same analysis to percentage of nurses, percentage of hospital beds, percentage of any kind of specialist, the same ratios more or less hold. So once again, this is the kind of disparity or inequity that exists in India in terms of healthcare personnel as well as infrastructure. So I'll summarize this with this slide, this particular section, which was on healthcare sector. And I'll just say that in this presentation today, I'm just going to talk about two types of inequities. And quickly, we looked at inequities in terms of healthcare infrastructure and the personal, and many people, especially those in remote areas and underserved communities, they do face challenges of even getting access to healthcare facilities or services, and which can result in, of course, not only delayed diagnosis, but delayed treatment also. And the second type of disparity, which I have not covered here, but I would like to little bit address today, is that of information related disparity. Already in healthcare sector, there is a power difference between patient and the clinician or the doctor. But even within the patient community, the access to information can vary widely depending on where you are located. And that even inability to access health-related information can affect people's ability to make or take decisions about their own health or about their family's health or their well-being. So this was my first section, and now we move to the second section, which is about what is AI. So if you go to internet, there will be lots of definitions. For this presentation, I have chosen a simple definition of AI. For me, AI is computers or software or computer systems trying to pursue or imitate human capabilities. And for this presentation, I have divided those capabilities also in three categories. Capabilities of humans which are related to sensors, sensing abilities or perception. Capabilities which are related to what I can call motor skills, muscle related, ability to move things from or act. That is second type of abilities. And third is brain or memory related abilities. These are the three type of capabilities that AI is trying to imitate. And that is the definition, my definition of AI. And quickly we can look at what are these examples of these capabilities that humans have that AI is trying to imitate. So for example, humans have the ability to understand speech. Most of you who speak English are able to understand what I'm saying today. We have vision. We are able to understand different languages. I speak Hindi as well as English as well as regional language Rajasthani. And some of you will also be able to process multiple languages. We can also recognize written text as well as what is typed, the text on this particular slide. So these are perception related capabilities which are trying to be imitated by AI. On action side, our ability to move things, take action are some examples, or our ability to create, ability to talk in multiple languages, right? ability to read something and convert it to speech, so text to speech, ability to have conversation in particular. So these are the examples of action or motor skills which we are trying to now imitate using AI. And similarly, on computational memory side, humans are pretty good at planning or reasoning. They are good at taking decisions. They are also fairly good at recognizing patterns as well as finding some errors in those patterns. So these, as I said, this was a very quick overview of what is AI and what is AI for me. The AI, the term that I'm using is a acronym for artificial intelligence. Many people do not like this term, artificial intelligence. So the other preferred terms that people use is augmented intelligence or computational intelligence or intelligent agent. For today's talk, I'll use the word AI most of the time, but I do want to illustrate the concept of AI through this concept of intelligent agent in my next slide. So this is again a very high level view of what an intelligent agent looks like. Okay, so the gray box that you see here is the intelligent agent, and what white box you see on the right hand side, large white box, is environment. So what intelligent agent is doing is it has some sensors. Now these sensors could be some, the user provides some data to it, user provides some prompts to it. It may have some sensors which are receiving some inputs or signals to it, but it will have some any of these signals or inputs, right, or data. So it receives those inputs from the environment. Internally, it has either, we can call them algorithms, flowcharts, conditions, or action rules, whatever name you want to give, but internally it has some conditions or action rules. It uses those algorithms or action rules as well as the information that it receives from the environment to decide what the environment is like, what it is expected to do, and then it decides to take, using the algorithm as well as the inputs, it decides to take what action that it is expected to take. And then it actually takes the action. Output of that action is available to us once again, either in the form of text, maybe video, maybe some other file, etc. So this is a simple representation of what AI or intelligent agent is. And I think it should be easy to appreciate AI through this chart. AI per se and machine learning has been around actually for a long time, nearly 70 years. So the term AI, artificial intelligence, and machine learning were coined in 1950s. And a chatbot called Eliza was available in 1960s, as well as the first mobile intelligent robot called Shaky was also developed in 1960s. Then there was a lull phase for a couple of decades, and by 1990s, there was a lot more progress on speech and video processing. And in early 21st century, IBM Watson came. There were personal assistants available. I think facial recognition became a standard technology. And in last couple of years, with the launch of ChatGPT, now almost all people, all general population also is aware about AI, especially generative AI, Gen AI as we call it, and some of its capabilities to answer questions as well as generate content. In terms of the current stage of where we are in terms of AI development, again, there's a very simplified view of where we are. As of now, we are at the stage of what is known as narrow AI or artificial narrow intelligence, whichever way you want to call it. But at this stage, the AI is able to imitate only one of the functions that, or one of the capabilities that humans have. That is the, in a way, current stage that we have. The next stage that is expected is known as generative AI or AGI, artificial general intelligence. By this stage, it is expected that AI will be as smart as normal human being virtually in most of the field. And the next stage after that, that is expected is stage 3 in this particular chart, is of ASI or super artificial intelligence or artificial super intelligence. By that stage, it is expected that AI will far exceed human capabilities in almost every field. As of now, we are in, as I said, we are in the ANI phase or narrow AI phase, where capabilities of AI is much less than the human capabilities. In 5 to 10 years, it is expected that we will have AGI, where the capabilities of AI will be almost at par with humans. And after that, couple of decades away, I think we are to reach the stage where AI will exceed the capabilities of humans practically in all the fields or domains. I also wanted to include one chart about data science related workflow and how AI machines relate to it. So in the dark green boxes here, we see the workflow, data science workflow from data production to data application. And here I have just put a few phases and how that is affected or brought in machines for some of the tasks in data science workflow. So with the advent of computers, the data storage and data calculation capabilities were now available through what I can call machines, right? Then with the availability of internet, data transmission was also possible through machines. Now with the wearables or Internet of Things and such devices which are connected to internet, we can now also collect data through machines, right? And now, finally, with the help of AI, it is possible to also even create data, for example, synthetic data we can create, as well as even use those for insights and take actions based on what insights we obtain. So with AI, we will be able to sort of do virtually all the entire workflow in data science. Okay, so this was my section on artificial intelligence, and now we move to the third and the last section of my talk, which is about application of AI, specifically in healthcare, and how it can be useful for improving equity and access. So what I was done is, because I was not sure, and this was a brief given to me that people may not know about healthcare, and people may not know about AI as well. So what I've done is I've taken 4 or 5 examples of what I can call consumer-facing AI applications, so that I'm assuming that almost everybody in the audience will be familiar with those consumer-facing AI applications. And then instead of explaining technology, I can extend that, saying if you understand this, how this same technology can be applied in healthcare. So first example that I'm taking, which is sort of consumer-facing, is recommendation engine. Almost everybody here in the audience, I'm sure, would have used some e-commerce website like Amazon or Flipkart in India, would have social media accounts. So you'll be seeing your feeds on LinkedIn or Instagram or Facebook. You may have some OTT platform, Netflix or otherwise. You may have some music player like Spotify or YouTube, etc. So each of these, when you search for whether a movie or a music, it provides you some recommendation. So underlying, there is some recommendation engine that is working. It sort of clusters what other people have liked. And based on that, it also tells you that if other people who were searching for this type of information had liked this, you are also likely to appreciate this type of information or music or feed. So in what you see on the screen is I went to Amazon and I searched for a notebook. So of course it gave me some highly rated brand for notebook. It also recommended that maybe I'm interested in purchasing a MacBook as well. And as well as, of course, it gave me another recommendation for a notebook. So this is an underlying technology. I will call it recommendation engine, which is working behind your social media feeds, movie recommendations, music recommendations, as well as recommendations on your e-commerce websites. Can we use the similar technology in healthcare? That is a question, of course. Yes, of course, we can use similar technology, and it can help in tackling some of the issues of inequity in healthcare sector. How we can use it? So it can, for example, such recommendation engine can be useful to improve medical personnel efficiency. And let me give an example. In India, typically, if you go to a doctor's office, there is a long waiting queue and you have to wait for a long time because the doctor is busy with the previous patient and has a lot of questions to ask and takes quite some time to take the vitals, ask the person the family history, his or her own complaints and symptoms, etc. Now, if we use a similar recommendation engine through an app, and gave it to an assistant, not to the clinician, not to the actual doctor. But in my opinion, the person doesn't even require medical expertise, but could be even a general assistant. We give such an app or with a recommendation engine to that person. Now that person, during the waiting time, can collect your vitals, can ask you your symptoms, can ask you your complaints. And as you start feeding this type of information to this recommendation engine, the engine itself will start suggesting next appropriate question to ask. So there's an example or application of recommendation engine in healthcare, which can take away time, important time of the clinicians, which can be replaced by some assistant outside the clinic, and that person can collect all this information, including your history, complaints, family history, etc. And by the time you walk into the clinician's office, that person sees your history, which has been collected by the assistant outside. And of course, he or she, your doctor, can further ask additional questions so that make sure that he or she is giving you correct advice. But this is an example of how recommendation engine or this same tech can be applied in healthcare, and it can improve medical personnel's efficiency. They can focus on important questions, and the basic information can be collected outside the clinic by their assistant. Similarly, the same technology of recommendation engine can also be used through the same app or to the doctor when the doctor is prescribing what it can actually give you recommendations for medicines. It can also avoid, if it is known that you are suffering from certain allergies, it can avoid certain medication, right? It can also give recommendations to avoid certain medication because it may interfere with other medications that you are on. So these are some of the examples of how recommendation engine can be applied in healthcare. And as I said, bare minimum that it can do is it can improve medical personnel's efficiency. They can focus on important tasks, and other sort of what I can call routine or administrative tasks can be given to assistants through this app. It's already done by at least one company, evolco.com. So this part of the screenshot that I've taken is from evolco.com. Next example that I can take, what is consumer facing, is automated speech recognition in voice assistants. Again, I'm reasonably sure most of you must have used or any of these, Alexa, Siri, or Google Assistant. These are examples of voice assistants which are based on automated speech recognition technology underlying. Many of us may have also used on many websites chatbots, and nowadays these chatbots are also available in multiple languages. Right now I'm speaking in English, but in India, maybe less than 10% of the people understand English. So 90% of the people in India do not understand English, right? So they should be able to converse in their own local language. Once again, this is how you can improve access to health information, and I'll talk about it in the next slide. So what I'm talking here is an example of consumer-facing application, and we'll quickly look at how similar technology can be useful in healthcare. So as I said, this type of ASR-based voice assistants or multilingual chatbots can be useful for improving access to healthcare information. This was one of the inequities I talked in my slide, in my summary slide on the healthcare section. For example, if there's a patient in ICU who may be bedridden and is not allowed to move about, but needs some assistance, again, the a voice assistant can be of use to that person to either ask for some information or ask for some sort of help. Similar tech, again, chatbots can be useful for appointment booking or answering patients' queries. What you see in the cartoon on this slide is an old lady asking a question to a clinician about her upcoming hernia surgery. But again, if these chatbots and voice assistants are available in healthcare, then this time of clinician can be saved. Or maybe one time this person can ask, but maybe this lady had more questions which she hesitated to ask, but she may feel comfortable to ask those type of questions if there was a reliable voice assistant or chatbot that is available. Also, unlike a clinician who has limited number of hours available and practices for certain number of hours in his or her clinic, a voice assistant or a chatbot is available 24/7. You can ask the questions multiple times, and old lady may forget, the same information that she has asked. She can ask multiple times, and there is no issue with that. So these are again some examples of how these voice assistants and chatbots can be useful. And I also pasted the same thing in Hindi, in a Devanagari script in Hindi here, that if this lady did not understand English, will also be able to ask the question in any of the languages that she is comfortable with. The next example that I want to take, which again call consumer facing application of AI, is autonomous vehicle. We also call them self-driven or self-driving cars. So now, as you can imagine, in case of autonomous vehicle, uh, there are hundreds of sensors that this vehicle, in this case, this red vehicle is what we are talking about, has hundreds of sensors inside. Of course, it needs to know its own environment and what it is at what speed is driving, but it also has to be aware about other cars in the vicinity. It has to know about road signs. It has to know about weather conditions. It has to know about traffic signals, etc. So it has multiple sensors, and then using all this input information, it is able to drive safely, able to change lanes, for example, and as well as I said, without causing accident, it is able to go from one place to another place safely. Can the same technology be applied in healthcare? Yes, we can apply that for using or developing surgical robots. Those are already available, surgical robots which can assist surgeons. This particular image I have taken from Tesla, and they have electrical vehicle as well as charging stations. So in the Tesla app, you can locate your own vehicle as well in the app. Not only that, you can go to the app and you can say, I want to know which charging station nearby in my vicinity is free. So suppose a particular charging station has 10 charging points available, but 6 are busy and only 4 are accessible at this point in time. The app shows how many points are available for you to charge your vehicle. You can book that in advance. Now, imagine if I had similar technology available to me in healthcare, what it means. The parallel example to what I said just now would be that I have a medical need. Can I go to equivalent of Google Map and search what hospitals are in the vicinity? Of course, I can do that just now also. But in India, I can't know how many beds are available. I do not know whether if there was a medical emergency, whether ICU bed is available in a nearby hospital. So what happens is a patient, in case of medical need, has to go to one place, then figures out that no, this ICU is completely filled in this particular, then a patient has to be transferred to another hospital in the vicinity. And in this process of transferring patient from one location to another location, critical time is lost and the person usually suffers. But if this information was readily available, just like, so imagine that on the app, you can find out how many charging points out of 10 are accessible to you, but we do not have technology to know how many ICU beds a particular hospital in the vicinity has free. So that is a type of technology, if it was available in healthcare, will be of tremendous use for better resource utilization. This is what I've tried to summarize here, sort of key takeaways from my previous slide, that just like autonomous vehicle, similar technologies can be useful. And what this news item here is about a patient in Rohini. Rohini is in Gurgaon, both are around Delhi. So there was a patient in one location in Delhi, and the surgeon was in another hospital in vicinity. These were about 40 kilometers apart, and the person operated on this patient remotely. So this is news last week, by the way. So it is equivalent of the autonomous vehicle that a person was able to operate a patient remotely. Now, what does it do in terms of equity and accessibility? If this technology, and this was just 40 kilometers, but it can be 400 kilometers or 4,000 kilometers. In my opinion, it doesn't matter as long as there is sufficient internet bandwidth. So the patient does not need to travel from his or her location, or the surgeon does not need to travel, in this case, from his or her location to where the patient is. So the patient can be in one location, surgeon can be in a location, but you are able to provide the expertise remotely. And this is one way you are able to overcome the inequity in terms of lack of healthcare personnel in all places, especially in remote areas and rural areas. And as I said, if information is available about what infrastructure are being used, what infrastructure is free, it can help in optimizing the resources which are available to healthcare sector. And similarly, if the charging station knew that this car is coming for charging, if similar way, if a hospital knew that a particular patient is coming there for treatment or diagnosis, again, I think they could prepare better and provide their services more efficiently. Also, last month there was a news about China unveiling their first AI hospital in the world, and it is supposed to have 14 AI doctors. I do not have more details, but I just included here. This is a sign of things to come, where a lot of AI will be used in hospitals, and in this case, looks like there are less number of human doctors and more AI doctors are there in this particular hospital. And the last example of AI, generative AI, how can we forget, has to be included. I'm reasonably sure that almost all of you are familiar with generative AI. Copilot is one. I've included a screenshot of Copilot here. ChatGPT, many of you may have used, and I think all of you are aware that we can ask questions, we can ask it to create some new slide or new image, new video, etc. So you can create something, you can summarize some information, whether it's a document, etc. And nowadays, more capabilities have been increased. So when I recently looked at it, it also has, for example, it can do some things for you. Again, it's a perfect example of a vacation AI agent or intelligent agent. Then now it can do things for you. So now the vacation planner is one new thing that I find. So it not only can you can not only ask question, create something or summarize, but you can also ask AI to now do certain things for you. And I think these capabilities will keep increasing with time. Once again, can we apply generative AI tech in healthcare? Of course, yes, we can apply. And what will it do? What can it do in healthcare sector? In my opinion, this generative AI can democratize at least the healthcare information and knowledge, and can bring it to both clinicians as well as the patients. And again, a quick example: suppose we have a medical need, and there are two choices in the vicinity that we have. One is a fresh medical graduate who has just finished his medical degree, and one doctor who is practicing for last 10 years. And if we have a choice, which doctor will choose to visit? I'm reasonably sure almost everybody say will prefer to go to a person who has been practicing for last 10 years. Why? Because the person who is fresh has not seen enough number of medical cases, and we feel that this person's expertise or skills or knowledge will be less than the doctor who has been practicing for 10 years. Can generative AI fill this knowledge or skill gap? And if you ask me, my answer would be yes. If not for 10 years, if I have to just take this as an example, maybe generative AI can augment this fresh medical graduate's capabilities to an extent that this knowledge gap from 10 years reduced to maybe 2-3 years. So what it will mean is, you have a fresh medical graduate, you provide him or her generative AI tools, and now that person is able to perform at a level of somebody who is having 6, 7, 8 years of practicing experience. And to me, that's a fantastic example or application of AI in healthcare. And as I said, this for me is able to reduce this. A person doesn't need to really practice for 6, 7, 8 years before he or she has the knowledge or skill of 6, 7 year experienced doctor. I think that's where AI will go. And of course, other similar examples of summarizing, creating, etc., can be done. AI, generative AI, can be useful for creating synthetic data. It can be used for summarizing medical records, which will again save. It is a sort of time-consuming work to summarize medical records, and again, if a lot of it is first given to AI, which can summarize, and then somebody can audit or review it, will save a lot of time by clinicians. So this is it. This is my last slide. So thank you. I'll just summarize. So in this particular talk, I covered 3 sections. The first section was about healthcare sector, primarily about India, because I am based in India. The second section was a quick introduction to AI. And the third section is where I talked about a few examples of consumer-facing AI applications and how some of those, without getting into technical details, how some of those applications, which you all may be familiar with, can be extended to healthcare. To summarize, we talked about two types of inequities in infrastructure and information, and AI can help in both these areas. This is a short snapshot. AI can, for example, provide what we covered, a few examples. I'm just summarizing those one more time. So AI can provide administrative support to healthcare professionals. It can free doctors' time. It can help in remote monitoring of patients, and it can reduce the disparities in monitoring of patients and preventing complications. We also looked at the how AI can be useful for robotic surgeries being performed remotely, as well as telemedicine. We did not talk much about telemedicine today, but this sort of improves the access to healthcare infrastructure and healthcare personnel. And again, it removes the need of traveling large distances and overcomes the barriers of distance. On the information side, AI can be useful to augment the knowledge and skills of both the healthcare professional as well as the patient. On the healthcare professional side, AI can augment the clinical knowledge and skills, and it can reduce the gap between experience of a very experienced person versus a new medical doctor. And AI will also improve the diagnostic and treatment accuracy. On patient side, as we looked at a quick example, AI can be useful for filling information gap, and multilingual capabilities can also overcome the barriers of language, because everybody does not speak English, and it will make the health information and services more accessible to the masses. Thank you very much. I'm done with my slides, and I've included my mobile number in India as well as my Gmail address as well as my work email address on the right hand side. If you scan this QR code, you'll get my same number on WhatsApp without having to type. I've also included my social media handles. So even if you are not able to ask some questions today, feel free to reach out to me in the future as well. Thank you very much for your time.
Thanks a lot, Mr. Prasad, Dr. Prasad, for your insights on the webinar today. We are getting few questions. One question that we see on our LinkedIn page is how can governments, tech companies, healthcare providers collaborate to promote AI and all the things that we've talked about in context of improving the accessibility as per your webinar.
So I didn't get the question, but broadly, I think I have covered how AI can, and I've sort of summarized here how AI can help. I at least used 4 different examples of what is happening, as I said, in consumer-facing apps, and how the similar technology can be extended to healthcare. So irrespective whether it's private sector or government organization, AI can help. AI will not solve everything. Let's also be clear. AI is not going to solve everything, but AI can do some bit, definitely.
Okay. We have another questions from the Zoom chat itself. What is it about the privacy issue of data collection of specific patient using AI? Is there any governance to take care of the private data from the patient collecting that is being collected by the AI, and how long that data should be stored? Is there a framework around? Is there a certain authority which is looking into it, monitoring it?
Okay, so I'll give some answer, and my short answer would be it depends on which country you are operating in. So that's a short answer, but the long answer would be yes. If you want to collect patient data, there are 2 things you'll need to do. You'll need to what is known as informed consent. You'll need to take the patient's consent if you want to use that person's data. So that is one informed consent you'll have to take for using the data for any research purposes or training purposes. That is one way. Second is sometimes what is done is you de-identify the data. You remove all the information that can be used to identify the patient, and then only the, I can say, clinical information which cannot be used to re-identify the patient. In that form, at least in India, recently government has allowed, uh, you know, to use those data for research, etc. So these are the two methods. So in this, if you want to use it for research in anonymized form, then you'll have to provide at least a notice to the patient that you are planning to use his or her data, but in anonymized form. But if you want to use it for any other purposes, then you'll have to take informed consent. So there are two ways you can handle it: informed consent as well as or providing notices. And but again, it will depend on which country you are operating. But process will be very similar to either of them.
Okay, great. Um, Another question is being asked is what are the most growing areas that needs, local market as well as global market? What are the key areas where AI companies, these new developments can actually take place? In India, we have a context that a lot of diagnostic related manual processes are being automated, and most or majority of our companies are focusing in those areas. Do you want to add on any other areas locally for Indian market and for global market that you see a lot of potential in, untapped potential in?
I think not sure, but I still think the, at least in India, Indian context, multilingual capability, which I also covered in my talk today. I think that is very, very important because 90% plus people do not speak English, and that itself is lacking. And by the way, that is not just lacking in healthcare; it is lacking even if you want to take support in for banking or many other aspects. So I think multilingual uh, automated speech recognition, those technologies are, I think, they have tremendous potential in the coming years
Okay.
in India
Thank you.
specifically.
Yes. Okay, we'll move on to the last questions. We are getting this question from basically must be from South Africa or Kenya. We get this question as so far, how many challenges, what are the challenges that have been incurred so far with integrating AI in rural and remote areas? I mean, given that these allow us to give us the accessibility, but what are the challenges, main challenges for the rural population in terms of embracing and accepting these technological changes, if you could?
So, okay, again, let me try to answer a few. So, again, in Indian context, in rural areas, the challenge will again start from other infrastructure. For example, though reach of internet and mobile phones has increased, but electricity is not available in all places, or if electricity is available, it is not uh, available 24/7. So it will start from, because just providing a surgical robo in such a location is not going to help if you don't have electricity, is what I'm trying to say there. So there will be challenges. Again, every country or location will have its own challenges. I'm just pointing out some of the Indian context challenges because I'm aware of those. So it has to look at problems at system level just by sending, or people talk about, I will send a medical device from Mumbai, which is a metro, to a nearby town. Now, using a drone. Now, drone is again a tool. You can use it to transport a medical device from a metro to a rural area. But if you don't have a personnel who is trained to use that medical device, it is not going to help. So this is what I'm trying to say, that you will have to look at what problem you are trying to solve and look at the entire ecosystem, and just solving it piecemeal or a small portion is not going to help, is my broad message.
Okay, great. That was a very thorough take about it. Uh, we have another questions. You can choose to answer this. What is the starting edge in introducing help of AI, especially in West Africa? If there's some insight that you can share about it.
Sorry, I'm not familiar with the geography, so maybe I can search and answer. I shared my contacts, and you can get in touch with me offline, and I can try to answer this question. I can research and answer, but right now I don't have. enough information.
Okay, that's understandable. One last question, sir. If you could recommend few apps that are out there that you would recommend our participants maybe to just go have a look for, which are in turn are actually doing what we have gone through the webinar in terms of promoting efficiency, helping building those recommender systems. Are there any apps specifically that are catering to doctors and nurses altogether?
So I used something called Cosmos. That was one that I used, which was reasonably all right. I used WH. I have seen WHO itself has launched some app called Sara. You can try that, and I can get back to you once again. Please ping me on either my email or this mobile number or WhatsApp, and I can get back to you with specific. Depending on what type of applications you are looking for, I can give you recommendations for specific apps. But this
Okay.
Cosmos and WHO Sara, these two I'm aware of.
Great, great. That was quite helpful though. Thanks a lot for your time, Dr. Prasad. Thank you all the participants for your engagement. We would be calling this session now. Please visit our ibac.org to become an authorized training partner with IABAC, and we will keep you all posted on all our upcoming events by email and across all our social media channels, and looking forward to connecting with you all soon. Thank you all for attending today's session, and have a nice day, everyone. Thanks a lot, Mr. Prasad. Thanks a lot,
Thank you,
Vishal.
IABSC, once again. Thank you to audience as well for participation.